May has been Melanoma Awareness Month, so we thought it's a good idea right now to alert you to the hazards of sun worshiping. An estimated 5 million people a year are diagnosed with skin cancer, more than 93,000 with melanoma. That is the most deadly form of skin cancer, and it claims an estimated 10,000 lives a year just in the United States. Now, there was a time when some of us, like me, worship the sun with reflectors like that, the suntan oil, and oh, what great tans. Only to learn many years later the costly effects of that marvelous tan. Basal cell, squamous cell, and melanoma cancers resulting from the sun exposure. To help you not make the same mistakes I did years ago, pleased to be joined now by Dr. Bruce Robinson, a specialist in adult and pediatric dermatology and national spokesman for the American Academy of Dermatology. And Dr. Robert Bard, he's a cancer imaging specialist who focuses on advanced 3D sonography to detect cancers, including breast, thyroid, prostate, skin, and melanomas. His technology could make painful Mohs surgeries. We'll explain that. Mohs surgeries to remove cancers obsolete. And they both have practices right here in Manhattan. Good to have you with us. Dr. Robinson, would you begin? What are the warning signs of skin problems from exposure to the sun?
The warning signs are the A, B, C, D, E's, we call them, especially when it comes to melanoma. So the A stands for asymmetry, moles that are not equally distributed. B, borders that are not nice and round. C, the color should be one color, not multicolored. The diameter, about the size of a pencil eraser, 6 millimeters. And E, any mole that is either rapidly growing or becomes symptomatic in any way, itch, hurts, or burns, Marvin.
And if you have a question, go see a doctor.
Absolutely. See your local dermatologist.
All right, we see all these skin blocks, you got SPF 20, 30, up to 80 now. Is there a safe one?
We say in the practice of dermatology that we ask our patients to practice safe sun. And by doing that, you want to use at least an SPF of 30 or greater.
Does it make any difference if you go up to 80, or is it just
diminishing returns after 30?
And what should you look for in there? I mean, I know there are different substances that you have in these different skin products.
Of importance is the mineral-based sunscreens, ones that have zinc oxide particularly, because that is a reflective surface that works right away. Nobody's allergic to zinc as we consume it in our diet, and still give us one of the broadest spectrums of coverage. You also want an additive that is a chemical sunscreen that covers a little bit more of the UVA where the mineral sunscreen falls off.
I know we all find our excuses when we get exposed to the sun, but are some of us more vulnerable than others?
Absolutely. So people with light hair, light eyes, very light skin are more susceptible, but nobody's immune from getting skin cancer.
All right, so once the damage is done, then we go to the skin detective, Dr. Bard here. He's got all his little gadgets in his office there in Manhattan. And how do you detect this? I mean, tell us about that.
We use safe, non-invasive ultrasound imaging, the same way you see the face of a baby inside the mother's uterus. You can see the skin cancer, you can see the depth of it, and you can see the shape. In other words, you get the margins with the medical imaging technologies we have, which show, again, both how deep it is, which is important for treatment, and also with the newer technologies, you can see the margins, which can make surgical excision less wide and, of course, reduce the scarring.
Now, you can detect very graphically a melanoma, and I think we have video. Why don't you describe what we're seeing as Rowie, as we take a look at that video? A melanoma is formed. There we go.
This is an interesting example showing the white line where the melanoma is on top, and that's where you would do a shave biopsy. But below that biopsy, that dark area, happens to be the fact that the melanoma has already metastasized. So in this case, it is smarter to do imaging first to make sure the tumor hasn't spread before you start cutting. And we can do this with many cancers. For example, with breast cancer or thyroid cancer, we can see if it's spread to the lymph nodes. As we saw with the previous patient, we can tell them it hasn't spread to the lymph nodes
Let's talk about this Mohs surgery I mentioned earlier. This is a procedure whereby a surgeon goes in once an individual has been diagnosed with cancer, with a skin cancer. They go in and these margins you talk about, they take out a little portion at a time until they determine they've cleared that section of any cancerous cells. But you can see this without the necessity of doing any surgical procedure.
Yes, with the 3D ultrasound imaging we have, not only can we see the depth of the tumor, which is important because some basal cell cancers can be treated easily with radiation and disappear, especially in older people who don't want scarring. But with the new laser optical technologies, you see the margins as well. So you actually get the depth and the borders of a tumor, which will reduce the surgical time.
I think we have a little thing there we can show where you can see the epidermis, you see the skin. If we can bring that up for a moment, it is kind of dark. No, this is what Dr. Robinson was talking about, the different forms
Yes, sir.
of melanoma. But there's another graphic in here, I think a video graphic, which shows too where the bone is located there in that one. And
yes, the bottom line, the white line in the middle of the screen is the bone, and on top of that there's a black area which happens to be the margins of the cancer. So in one 3-minute ultrasound imaging session, you see the black tumor on top, and then the thin spread out tentacles of the tumor are the margins. So you get everything with one 3D image setting.
And this eliminates the necessity of the in-depth surgical procedure.
The surgeon knows how deep he has to
Precisely
go.
where to go. He doesn't have to probe any
Exactly.
deeper. Okay, that could be a very painful procedure. What guidance do you offer? I hear we're coming into the summer and we're all looking forward to coming out of winter and we're all looking, no sun reflectors any longer. I've thrown that away. What's your advice and guidance to people?
I love people to practice safe sun strategy. And that really incorporates using the proper sunscreen, as you mentioned. But in addition, to make sure we use sun protective clothing where possible, a hat with a 4-inch brim, UVA, UVB coverage sunglasses. Make sure you do a self-examination once a month, especially women when they do their breast exam. Grab your partner, they check you, you check them. Great for couples. And then perhaps you make sure that you get your yearly skin exam with your local dermatologist.
And Dr. Bart could do this with the 3D sonography imaging.
Yes, there are two things that dermatologists are not good at seeing, and that's tumor regression. Specifically, in basal cell cancers, there are white dots, and the more of these white dots, the more aggressive it is. This happens to be in a textbook that's coming out that I wrote for the end of December. Secondly, in melanoma, even more importantly, if you have this many tumor vessels going into a melanoma, it's bad. If you have this many, it's less aggressive. And of course, if you treat it, if the tumor vessels go from this to this, you better change treatment.
Also, Dr. Robinson, it's very important too with children, particularly babies. You have to have extra protection for them.
Yeah, so we say that babies should be protected from the get-go. Try to keep them out of the sun completely, but if you can't do that, at least use a mineral-based sunscreen and really try to keep your activities in the shade and really try to avoid the sun between the hours of 10 and 2.
Okay, Dr. Bruce Robinson, Dr. Robert Bard, thank you very much. And advice that I've taken over the years, we all love the sun, but just be more conscious of how much you're getting of that. So thank you so much for your insight.
Thank you.
And that'll do it for our program for this week. If you have any comments or wish to see this broadcast again, log on to our website at pix11.com/newscloseup. I'm Marvin Scott. Thanks so much for joining us. Enjoy the rest of your Sunday, everyone.